Active surveillance is where we actively and closely monitor a patient's prostate cancer, ensuring that their cancer is remaining stable and not transitioning to a more aggressive form. It allows the patient to avoid treatments which can cause side effects.
How do you know if from one patient to another somebody is a candidate for that?
Yeah. So patients are candidates for active surveillance if they are defined as very low risk or low risk, which means that their cancer has to be confined to the prostate. They have a Gleason score that's low, like a Gleason score 6, and their PSA is typically less than 10.
I'm going to guess, because this is the way I feel, that some patients would just not be able to comprehend not getting treatment. Like, to me, that's a foreign concept. How do you make somebody feel comfortable with that?
Yeah, that's a really important point because active surveillance can cause a lot of patients to have anxiety, especially if they hold a lot of anxiety with just having a diagnosis of cancer. So what I try to do is reassure patients who have very low risk or low risk prostate cancer that this is a cancer that is extremely unlikely to harm them, and that the goal of prostate cancer active surveillance is to help them avoid unnecessary side effects that really any treatment can cause, surgery or radiation, and that the purpose of active surveillance is to catch their cancer early if it decides to grow and to move them on towards treatments, allowing them to not compromise their outcome for cure.
How does it work? It's yearly, or is it throughout the year? How does the surveillance work?
Yeah. So during the first year of active surveillance, we see them at least every 6 months with a PSA blood test. We typically get an MRI within that first year if they haven't had one. And they need a repeat biopsy at the anniversary of starting active surveillance. If their cancer is proving stable, then we see them every 6 months with a PSA blood test, and then use MRI and biopsy intermittently every 2 to 3 years to just more closely check in on their cancer.